I'd like to turn the subcommittee's attention to Amendment 0981H, which is the one that was just passed around. This was the official language that we talked about the last time we met on this bill. Did have an opportunity to look into the one concern that I had mentioned, and it's fine. So I feel comfortable with that. So once again, line 12C just defines stationware, which wasn't defined before. Hi, Peter. Which wasn't defined before. Makes the requirement that the manufacturer tells us whether or not PFAS is in the material later on. And then on the back side, one thing that was changed from what we talked about on page 2, line 9, that paragraph: should a safe alternative to the current firefighting personnel protective equipment be designed and manufactured, fire departments may give preference to that. It was should, but nobody really cares all that much that I've talked to out here, because really the meat of the bill is below that. In section 6, beginning January 1st, 2025, fire departments shall not provide as an option the purchasing of that station fireware. And then on July 1st, 2025, fire departments shall not provide as an option the wearing of the same. So that just addresses Representative Lekis's concern about downshifting cost. It gives them time to get their allowance and then time to go out and make the purchase, so that they can transition away from the PFAS-laden stuff to safer alternatives. So that, once again, was just kind of the synopsis on the amendment that we talked about last time. We just didn't have it officially. So the subcommittee wants to just take a couple minutes to look at it, or if you feel comfortable with it, you can let me know.
This is the language we've been talking about.
Exactly.
So it's just a question of having it physically, so now we can vote on it.
Yep.
And of course, we got some people here this morning. I look over there, and some people who have not been here before, maybe mostly all of them, I'm not sure. But we certainly want to hear from them whether there are issues, and especially Representative Prue, who himself is a longtime he's a former member of EDNA, as you probably know, and very involved in this type of situation. That's why he's here this morning.
Yeah. I know he's here for the next one, actually, because the next one's his bill, but he can speak on this one if he'd like as well.
Anyway, yeah.
But anyway, yes, I just wanted to hear from the committee first if you had any concerns with the language, and then I'll open up to anybody out here who would like to speak on this if there are any concerns with the language, if you've been able to see the language. Everybody's comfortable with it? Very good. With that then, I'm comfortable with it. If the committee's comfortable with it, I'm willing to entertain a motion from the subcommittee.
Were you just about, I'm happy to make the motion and ought to pass.
With amendment?
Yeah, on the amendment.
On the amendment, right?
Yeah.
Okay. We'll just, all in favor?
On the
Okay.
amendment.
On the amendment, and then
I move, ought to pass with amendment.
second, Fred, second. All in favor? Okay. Awesome. Great. Guys, it was that easy. You're welcome. And I don't know who's here. Everybody might be here for 1079. Give me a second to fill out the paperwork, and then we'll move on to 1079. If you want to remind yourselves, I handed out Representative Prue's amendment to 1079, which is 5 pages long. If you guys want to just kind of take a glance at that while I'm filling out the paperwork.
You are speaking of 333, right?
Yes, 333H. Yep.
Okay.
Welcome back. Would you like to join us? I have one if you need. Welcome back to ED&A.
Hi, nice to be back.
So when we had the original public hearing on it, we didn't really go into any form of detail on the amendment that you were presenting, if I remember correctly. So I just kind of wanted to give you the opportunity to kind of present that amendment and give us the highlights as you see them. And
So we were trying to include more emergency responders. One of the groups I was looking at is the emergency room personnel in hospitals, as they've requested our services quite a bit lately. And when we were doing that, we decided to go with the definition that the feds use for emergency responders, because they kind of change it from time to time, add, delete. So that way we wouldn't have to keep coming back to this to change it, to add or delete. We can just float along with them, is what we were looking to do.
real quickly, Representative Prue, so where is that found? If you want to attach it to the federal definition,
So in the highlight, behavioral emergency response, public safety workers. Oh, wait a minute. Da, da, da.
if you give us a page and line number, that'd be helpful.
Yep. Sorry. Planned on being here early and that didn't work out.
Because I didn't see a federal
Nope.
in there. There's a couple of RSAs, but
Yep. Hang on. I'll get there. So one of the things that we did, page 2, line 21, hospital emergency personnel means staff rendering care, rescue support, life-saving while in an emergency department. So it includes anybody that would have come into contact with that patient at that time. You want to come up? I'm going to bring Justin.
yeah,
He-
please join
he-
us.
He helped
It's
write
pretty.
it.
It's a subcommittee meeting. It's pretty informal.
Good morning, gentlemen. Just, some of you are very familiar faces. I appreciate the time with you this morning. For those of you that I have not had the pleasure to meet, my name is Justin Breton. I am the Mental Health and Wellness Coordinator at the Manchester Police Department. I am the coordinator for our Southern New Hampshire Critical Incident Stress Management Team. And the members that you see behind me are some of the best peer supporters that we have in the state. So we're very fortunate to have this time with you and happy to answer all of these questions. What Mr. Prue, if I can draw your attention to line 20.
Which page, sorry?
On the second page.
Okay.
Is where we start to talk about the addition of emergency department personnel. It's important that we define that, as Representative Prue said, and I'm just looking for you. We do that, and we utilize the language.
If we could just clarify on the copy that we have, line 20, you said on page 2, just says state, city, town, or private emergency services level.
Sorry, 21.
Okay, you're the hospital emergency personnel.
Yes, sir.
Okay. Yep.
So that is where we start to define those additional individuals that we're looking to support. As Representative Prue said, that's come from a direct request from the hospitals for that support.
Sure.
The men and women in those departments see what we bring in, trauma and devastation to them on a daily basis. And they're left to try to help not only law enforcement put the pieces back together, but the men and women in the communities that we serve. They're serving our families as well. And when we bring them those individuals and expose them to critical incidents, they're often left unsupported. And that is one of the genuine intent of this change, is to make sure that those folks have the support that they need after they're exposed to that trauma.
Okay.
One of the other aspects that we were hoping to utilize to bolster the statute was to help address the underserved retired population of the law enforcement community. I don't know how much historical knowledge you gentlemen have of this statute, but we were fortunate in the state of New Hampshire to have it passed in 2013. This has been a tool that we have utilized across the state in all assets of for the first responder community to really break down the stigma and barriers that exist to accessing appropriate culturally competent mental health support services across the state. When we wrote the statute, one of the biggest oversights was the need to not only retain our retired personnel on our teams, but also to make sure that our retired personnel had access to support services well after they left our profession. You gentlemen might have heard a lot of talk throughout the State House this year about the recruitment and retention issues amongst the first responder community. But being able to retain our retired members on our teams as well as provide services to them will absolutely be a tool that we can utilize to help mitigate some of those recruitment and retention issues.
Question on that one. So page 2, line 28, I see where we add retired to members of the critical incident stress management team.
Yes, sir.
Where are we adding the services?
So in that, those services provided to retirees would come in under any individuals receiving services. So we have bolstered that section. It already stated that the individuals receiving services were confidential and protected by the confidentiality statute as well. But we further expanded that with a more clearly outlined definition, or not definition, but more clearly outlined language.
Sure. Where
in
where
that
is
section.
that though? What page and line
that's
number so
gonna
we
be-
can take
bear
a
with
look
me
at
for
it?
one moment, sir.
Yep. No rush.
So that is going to be on page 3, and it starts on line 4, nor any person.
Okay, so you're looking to nor any person to include retired people?
Correct, sir.
You didn't want to specify that more clearly? Because we can. I mean, we have time to make changes.
If the subcommittee feels that that would help answer any and all doubt or speculation in the future, I absolutely think now is the time to do that.
Yeah. Well, I'll make a note of it anyway so we can discuss it. Yeah, Peter, did you want to say something?
Thank you very much, Mr. Chairman. So going back to page 2, I have an issue with the fact that line 22 said, while in the hospital emergency department. So how about if they're outside or they get called out somehow? It seems to me that the while in is not the central aspect. The thing is, are they attached to the hospital emergency department? That's their employment. That's their that's their assignment and so forth. Whether they're actually physically in the department, I think, is irrelevant. If that's their normal place and they are attached to the hospital emergency department, either full time or part time or whatever, and so if they're away, called out, across the block, across the street, whatever, they are part of the. It's the
Sure,
fact that they're exposed to this type of work environment
So
that
be-
is so stressful. That's
And I'm okay with expanding that, but
Yeah,
the-
before
that-
your answer, Representative Pridge, just want a clarification. Sorry. Yeah, I think the difficulty, Representative Schmidt, in this, from my perspective, is we're looking to make sure that anybody who's in the space when it happens has access to the care. They may or may not be an actual employee, correct?
Well,
I
we
mean,
could have like a respiratory tech come down from
Sure.
the floor, X-ray tech come in.
right.
So they're in that space. That's not their official area to work, is the emergency room. It's just they come because it's a big emergency. So you could get a nurse from the ICU come down to help them.
Mhm.
So if they're in that space working, that's fine. But I also see Representative Schmidt's idea is sometimes they'll take a nurse from the emergency department, stick them in the ambulance for a critical transport to another hospital or something like that.
Right.
But I would think that because they came out of the emergency room with that patient, they should be covered, but you know.
well, but you're also raising a complete different point, and that is, you got somebody who is not ordinarily attached to the emergency department, but that day they're there and they're exposed to that traumatic experience, and maybe it's only one-time thing, but if it's bad enough, one time is enough. You're in there and you're
Correct.
seeing something god awful. then you've been traumatized. So you're covering something of a different aspect, but I think both things are equally valid.
That was the point that I was trying to bring
Yeah,
out. I
yeah.
think you got to be careful what you do with the language because you don't want to negate the one by adding the other. Representative Boyd, did you want to say something?
Thought is exposure. I mean, you could have civilian personnel that happen to be in there with one of their family members, and they have to see this as they're being rolled into the emergency room.
And of course, the other component to this that I think we'll have to keep in mind and try to keep balanced, whatever we decide to do and work on, is this is a peer support network as well, correct? So, I mean,
Yeah.
you aren't licensed in the same way as a licensed mental health professional, so,
We
right?
work-
So
we
we've got to
work
be a
with
little
them, but
careful.
We have specific training, and we have to be trained to fit into this guideline.
Right. So, I mean, the family member may not fit into this
Correct.
because they're not a peer.
There is actually a DBAR team that does civilians, and that's their job, and they're run by the state, and we refer them to that
Okay.
or the mental health catchment in their area.
Okay, that's good to know. Any other questions at this point? All right, if you want to continue.
And just for some clarification for Representative Schmidt, we hope our genuine intent of covering all those people is very clearly defined on page 2, line 21, under subparagraph number I, is where it says hospital emergency department personnel means staff rendering care. So the genuine intent there is to capture all of those individuals that you're concerned about. And so I do hope that we adequately address that for you in that language.
Well, we do, but I mean, Representative Prue has pointed out why it says while in, because if they're there, whether they're ordinarily attached to, but if they're there and on that day at that time and expose that trauma,
Yes, sir.
then we need to protect them too.
Thank you.
Any other things that you'd like to highlight from the bill? Because I'd like to, at some point too, go kind of through line by line and just address a couple of thoughts I had. But
Yeah, absolutely. I just will, before we move on, I would like to just make sure to fully answer your question is that it is correct, we are not licensed, but we are trained peer supporters and certified by the International Critical Incident Stress Foundation to offer these services. The delivery, the supports that we're offering are not clinical in nature. We are trained to recognize the normal reactions to stress and trauma. We're trained to educate our peers on what those are, normalize those reactions. And the biggest component of our peer support network is to make sure that we're able to refer out to culturally competent licensed providers when those needs arise. We are genuinely the bridge to those support services that are usually very difficult for our personnel to access because of the stigma that surrounds first responders reaching out for help. So our genuine mission is to make sure that we break down those barriers and we are able to connect our peers to those licensed providers to get the support that they need.
right, my main concern was because it is peer driven, is there liability if you step outside the scope in some way? So if we've gone beyond peer to somebody else, are you at all liable for offering services to somebody who, according to the what was it, the ICISF?
ICISF.
Yeah, that has basically
So
given us your scope of practice, for lack of a better way of putting it.
our scope of practice, but it's also the training.
If you could use the mic, Representative Prue, sorry.
Sorry. It's also the training, right? If you stay in that model, you should be somewhat protected. What happens is the confidentiality falls off if it's not one of those
Gotcha.
members.
Okay.
right? So, and that's what we're looking for, is to make sure we can provide services to the people. And we only really seek out first responders, right? But they come in many sizes and shapes. Ski patrol, the mountain rescue people, wide area. Sometimes you think, oh yeah, I forgot all about those guys. But we want to make sure we have that confidentiality, right? Because, like he said, the stigma is still there, right? And we want to make sure, and maybe not so much on the fire EMS side, but I know on the police side, it's always been a concern that if my boss finds out, what will happen to my job, right? and more of that stigma and that whole thing is going away, but it's still in the back of a lot of minds. So they want to be sure that when they seek these services, what's said in the room stays in the room, right? So, and that's what we're trying to make sure happens, is that they can come in confidence, know that what's said in the room stays in the room, and when we send them off to a mental health professional, that follows them, right? So that's our big thing about this.
Okay, for members of the committee, is everybody pretty well feel comfortable with the intent of the material, what we're trying to accomplish? All right. So having said that, I think we get the concept, and I think for the most part, it seems
Yep.
like we're pretty much in support of the concept. Just like to get into the specifics of the actual amendments, which would become law, to make sure that we know what we're doing and what we're recommending. And
Yep.
so if I may, on page 1, line 8, we start to see the term. So we've crossed out emergency service provider as a result of response to the incident, and we've replaced it with emergency response / public safety worker. We're going to use that several times. So that term, I see that it's used, and the meaning of it can be inferred at the top of page 2 in that first paragraph, paragraph F. The meaning of that term can be inferred from there. Is that defined anywhere in statute, though, or should we be defining that in statute? Because it's referenced so much in this. If we don't know what it is, then
Thank you, sir. Very good question. So that title came from a direct result of our commission to study incidents of PTSD amongst first responders. There is a committee that's formed, legislatively mandated and in place, where there are representatives from the first responder community that come together on a monthly basis to look into how we can better support our first responders. There's members of your subcommittee on that panel with us. We worked very hard to create some additional supports for families and survivors of suicide. And that term and definition comes directly from some work that we did within the workers' compensation statute, which is 281A. And so that title comes specifically from that language to make sure that the definition of first responders is accurately represented throughout statutes across the state. I think it's important to make sure that we mirror existing language in other places. And so the language proposal that you see there is a means to try to clean up our statutes across the board when it comes to dealing with issues revolving around first responders.
okay. So let me just oops. There it is. All right, so 281. You said 281A?
Correct. I believe that's the workers' compensation.
That's workers' compensation?
Yes, sir.
So do you know what part underneath that?
Really testing my memory, sir.
Yeah, I've
believe
got the
it's
list if you want to look at it.
17, maybe?
I've got the list if you want to look at it.
Thank you.
Yep, incident. Yep, 17. Incident post-traumatic stress.
So that's our peer support statute. So RSA 281-A,
Semicolon 17E.
and then in VC is where emergency response and public safety workers are defined. Correct. Yes.
So if you follow on page 2,
One second, Representative. I'm so sorry. So 281A 17, and then you said Roman numeral 5.
Nope, sir. So 281A,
Yep.
2, and it falls under subsection V-C.
2. Maybe I'm just looking up as well.
That was done in last legislative session.
Maybe it's not. That could be the problem. I was like, there's not one here. Do
The-
you mind if I take this?
No, not at all.
Perfect. Thank you.
It's just not updated yet.
It'll be in next time they print it.
Oh.
Okay, I'm not going crazy. It's just not there yet. All right. So, emergency response public safety worker means call, volunteer, or regular firefighters, law enforcement officers certified under RSA 106L, certified county corrections officers, emergency communication dispatchers, and rescue or ambulance workers, including ambulance service, emergency medical personnel, first responder service, and volunteer personnel. And that matches what you did on page 2 in the first paragraph.
Yep. And you'll see that we added,
Hospital emergency personnel.
corrections, sheriffs, deputy sheriffs, state police, civilian law enforcement, civilian county corrections, and then it goes into the volunteer and regular firefighter.
Okay, so I mean, and the members of the subcommittee can jump in if you have thoughts on this. If you're going to use this and you want to keep it consistent, then shouldn't we either amend RSA 281 to include these things,
Is this in?
or
So the one issue with doing that is you're going to add, if you're going to look to add the emergency the hospital staff to that, you're going to open up the whole workers' comp statute to adding those people and including those people within those benefits, because that's where that's what that statute specifically addresses, the compensation and support that's available to those first responders during workers' comp claims. So that would be, I believe, a whole nother discussion of whether or not those people are eligible, those individuals are eligible for those supports through that statute.
Sure.
It seemed a little bit out of the scope of what we were trying
Yeah,
to
no,
achieve.
I agree with you. The concern that I have primarily is you said that you wanted to keep it for consistency across the RSAs, but this isn't going to be consistent across the RSAs because you're changing. If we keep this as the standard, which it's not really it's not in this section of the RSAs, right? It's under workman's compensation in the RSAs. You're including more people than just the people in the emergency response public safety worker over here. So my concern is, and my question is, should we be putting a definition into this section that defines emergency response public safety worker and includes the people that you want it to include?
So in that commission, it was all about, a lot of it was about workman's comp. They had people for Primax and labor and stuff. So for whatever reason, they didn't want to include them in that section in the workers' comp. But we want to include them in our offering.
Right.
So we added that on top of that.
Right. And my question is,
So-
and Peter, you might know better than I, instead of doing it here in the first paragraph on page 2, when we're dealing with definitions on page 1, should we have a definition section that says emergency response public safety worker for the purposes of this subdivision? Emergency response public safety worker shall include any law enforcement officer, roll them out so that it's defined in the statute. And then when we get to paragraph 2, or paragraph 1 on page 2, you don't have to list them again. You can just refer to the definition that we've already laid out. And that way, if it comes up again, you can just refer back to the definition. Because as it stands at this point, if you want to make change in the future or something else happen, you're going to have to go back and change every
everything.
other
So
place
you
that
can
it's
just change
listed.
the definition next time.
Does that make sense to people? Okay.
Sure.
Because it's not the same as you have it listed.
So you
somewhere
want to
else.
take that paragraph and pretty much make it a definition.
I want to take that paragraph, make it a definition in the first section
Yep.
under definitions, and then when you get to this section, you can literally just say critical incident stress management team member. Oh, and by the way, is that supposed to be team member or team member on line 1? Team members twice. Is it supposed to be there twice? It doesn't seem like it is.
Oh, yeah.
Strike one of those.
So
Plural. Team member or team members, plural.
Okay, make it team members.
Yes, sir.
Okay, fix that. So yeah, the paragraph would say critical incident stress management team member or team members means an emergency response public safety worker specially trained to provide critical incident stress management and crisis intervention services as a member of an organized and registered team. Does that make sense?
Yes, sir. That does make sense.
Okay.
Especially if we clearly define that on page 1.
And this is essentially the definition that you're looking for, correct?
Yes, sir.
Okay, very good. Anything from the committee? Yes, Representative Schmidt.
Thank you, Mr. Chairman. So it occurs to me that that we're getting into a situation where we've got this is all useful. I'm not trying to downgrade it whatsoever, but what we're doing is we're creating a category that's got a long tail, right? So and these people are in that category. Do we want to create some kind of an acronym? Because otherwise, we've got half a paragraph just defining the people or naming the people, I should say. The definition is important because everybody, and these people are, they're regular members. So there are acronyms out there like EMT. We don't have to say emergency management. We know EMT, it's a trope. It's a,
So once we define this on page 1, then we can just use critical CISM team member.
okay. Oh, it's just that I'm raising the issue because to the degree that we have a long,
Yep.
it becomes awkward because.
And I think unfortunately it has to be a long tail, because if you don't define them, then somebody will come along and say, they're not covered. They don't get the confidentiality, they don't get the services. And if you gave them services, now we can hear we have to know what they said, and we can compel you.
I get it, and I'm not quarreling with that
Yep.
at all.
Yep.
The thing is, if you've got, it's just like this committee is called ED&A, because otherwise, if we said executive departments and administration every time, we'd be halfway through the day before we got the name of the committee out there.
My
And
family still can't
and
say
we
it.
got something that we can
Right.
abbreviate.
CISM team member.
Okay. Even that is a bunch of words.
Team member?
No, that's too few. What I'm looking for is an acronym, because then you've got something that becomes, people think this person is a,
CSM.
CISM
I'm only
team.
raising the issue.
CSMTM.
I'm not saying I can't support this because there's just too damn many words here.
Give that some thought, guys. Okay, so that would take care of my first concern, which was making sure that that was defined so that we had a workable definition for what exactly it was that we were talking about. Thoughts? And other people can take the mic if they'd like to share. I mean, you guys can switch out a little bit, you know.
Absolutely.
So
I think
instead of second person, we can get it first person.
we just wanted to clarify to get back to where some of the initial language came from,
Yeah.
which might help explain why we were trying to mirror the existing language in
Oh yeah, no, I
281.
understand the it's good to mirror the language. I
Yeah.
just want to make sure that, you know, we're clearly defining what we're talking about here.
Yes.
Good morning. My name is Bill Atkinson. I'm the recently retired Assistant Fire Chief in Nashua. I've got 37 years in the fire service. When we were initially working on this, we looked at the Homeland Security and Homeland Security's definition of first responder. And we kind of tossed that around, but we didn't want to necessarily add a new definition in. But to answer, I'm not sure-
Representative Simon. Yeah. Or
Sorry.
Matt, whatever.
To answer your initial question of where we got our, where you could find the definition, according to federal law 6 USC 101 colon
So
6.
Can you slow that down and give it to me again?
The law is enacted by Congress from 2002 to present. It's defined
Yeah, the actual number, the federal number.
it's 6
Mhm.
USC 101 colon 6.
Okay, great.
And that basically defines emergency response provider. And that says that it means federal, state, and local governmental and non-governmental emergency, public safety, fire, law enforcement, emergency response, emergency medical, including hospital emergency facilities, and related personnel, agencies, and authorities.
Okay.
So that's the federal, when Homeland Security was formed, they came up with a definition that also applies, it goes into other agencies, but basically Homeland Security said this is the definition that we're going to use to define emergency response providers.
And have we gone outside of that definition here? Are there more people involved than are in that definition?
This definition is a very global definition,
Right.
and I think here in New Hampshire, we're trying to kind of tighten that up a little bit.
Okay.
Because confidentiality is pretty much what drives everything that we do.
Yeah.
As far as a peer support team and members of a peer support team. So we were just trying to be perhaps too specific, but we want to make sure that we covered everyone that may be, to your point, sir, we want to cover everyone that may be impacted by a traumatic event.
Right. Yeah. Just for clarification purposes, the only reason why I asked was because originally Representative Prue had mentioned potentially wanting to attach the definition to that. But that is not exactly what we have in this bill. And so just from the preference, so that we can discuss it from the preference of you guys, was the hope to connect it actually in RSA to that federal statute, or do you want to stick with the definition that you've come up with?
I think we would stick with the definition that
Okay.
we've come up with. I'm
I
just
prefer
here
that too,
trying
so.
to answer your specific question on where we sort of some more additional background information.
Yep. Perfect. I appreciate it. Thank you.
Thank you.
Any questions from the committee? No? Okay. Are we good with the definition component? Okay. So my next question, further down on page 1, starting in line 22, that paragraph, critical incident stress management and crisis intervention services means consultation, peer support, we're striking counseling, debriefing, diffusing, intervention services, management, prevention, and referral provided by a critical incident stress management team and or team member. The question that I have is it necessary from your perspective to put in team if a single team member is all that's necessary?
So I guess we provide like two different kinds of service, right? You have the peer one-on-one, and we do debriefings and diffusings, which is a team effort. At least 2 to 3 people go, we sit in a room with 15, 20 people, whoever were involved in the incident, and debrief them. And then, so it may be a team thing, but if you want to just leave it as a team member, that one team member making the referral.
No, I actually, no, it's helpful. The reason why I asked the question is to bring out, I think, what you did. So the debriefing and diffusing, those are two
So
things that would
because-
more likely be a
Right,
team
because
sort
there
of thing.
is a team that provides a service, and then there can be just one team member that provides the service.
Yeah, let me just, I'll think about that a little bit as far as
Okay.
potential wording or thoughts on it, but it's probably not life or death, but I just wanted to know why the differentiation between the two. Anything from the committee? We talked about the third one that I had, which was on line 1. We talked about the paragraph. Anything else on page 2, the addition of the hospital emergency department personnel before we move on from that one? I think we talked about that for a bit, so. That's just them adding the department. We talked about exposure and potentially trying to find some. Well, the amendment that I have here, yes, it's actually Representative Prue's amendment, but 0333H. this is where you had brought up your concern about other people who were outside of the emergency department, but we can have that discussion and try to figure out. But just wanted to make sure there were no more questions on that particular phrase there before we move on past it.
I think we're good.
Okay. Next, line 26, the team shall be registered with the ICISF, which we know who that is, or a similar organization, which I know frequently pops up in statute. It's not unheard of to put that language in. It's a little bit boilerplate. Just curious who those other organizations may be that might come into play. And then it says to maintain training standards to date as required. I'm assuming as required by ICISF.
Yes. Yes.
And then who holds you accountable if you do not hold those standards as required? Does ICISF handle it, or do we handle it? Who's holding you accountable for not meeting those standards? Because we're giving you the right in statute, right, to
Right.
do this. So if the only people overseeing you are ICISF, I just have a question about that.
Yeah, it would be the ICISF and the Director of Safety also helps oversee and identify any of those other training entities or organizations that teams are allowed to be trained by.
Okay, so Director of Safety. So if we threw in potentially something about the Director of Safety, that would be something that you're doing presently.
Correct.
Okay. I just want to make sure that we potentially have that in there so that there is someone having to do with the state of New Hampshire that has a say in what's going on. Good. Okay. Anything from anybody else on that particular section? Good. All right. Line 28. All critical incident stress management team members, sworn, civilian, or retired, we get the retired in there, shall be designated by police chief, sheriff, director of the Division of State Police, fire chief, commissioner of the Department of Corrections, superintendent of county corrections, chief of emergency medical services, director of the Division of Emergency Services and Communications, or the head of a union of emergency response public safety workers as defined by RSA 281A2. Obviously, some of those are already in statute. You're adding some. Is this universal? So if the commissioner of the Department of Corrections designates a critical incident stress management team member, can that team member work across all disciplines? Or is it specific to the Department of Corrections?
So they can provide support services to all first responders.
Okay, all first responders. And from your experience, you're comfortable with all of those people making that call?
Yes, sir.
Okay. Okay, so I think we added my next question, which is anything from the committee on page 2 before we go to page 3? Okay. I think we answered my next question. We added, nor any person receiving any critical incident stress management and crisis intervention. That was specifically for retired people, but is the scope intended to be larger than that? Do you have somebody else in mind other than retired individuals?
Not at this time, sir.
Okay.
It may be something that we should discuss, especially if you already have that question
Yeah.
and we have the opportunity to put it in now. It may be very important to make sure it's very clear that that is the population we're intending to support. There are the retirees.
Okay.
I agree with you on that.
Yeah, I don't want to go outside of the scope of what you're looking for
Correct.
and accidentally add in other people that we're not intending to. So this is specifically for retired individuals.
To making sure that all first responders receiving services are protected, to include retirees. Yes, sir.
Okay, very good. Anything else from the committee?
Yeah, I would almost leave it any person receiving.
Yeah, sorry, you gotta talk to
I would leave it any person receiving critical incident stress interventions are covered.
Yeah,
Only because,
no, I understand what you're saying, and I'm not trying to
yep.
create a problem in there. I don't know. I'd like to hear actually Mr. Osterhout's thoughts on it. Potentially, he might be helpful on this. I'm not sure. I'm not sure if that jumps out at me as continuum of care after they're retired, because they're no longer a peer at that point. We haven't defined that.
So we can add retirees or any person receiving critical incident stress intervention.
We'll work on it. We'll throw it back past you to make sure
Alright.
that whatever, if we change it,
All right.
it's you're comfortable with it. You don't have any concerns that we're not thinking of. But I just want to make sure it's clear so that and then later on line 5 you add disclosed, which makes sense. So you're getting both the person providing the service and receiving the service involved there, which makes sense to me anyway. So that will lead us down to line 13 and following, where we're changing the definition slightly of what is deemed confidential. Is the committee comfortable moving on to that point? Okay. Just walk us through why you changed what you changed and what you're hoping it'll accomplish.
Absolutely. We're genuinely hoping that the committee doesn't see it as a change, but more of a clarification.
Okay.
And making sure that we're very clearly defining for everybody when and how we need to get our folks additional support services when they need it. Looking at the statute, we were concerned in other departments coming on board with offering peer support services we're also looking for some clarification. So that's why we really leaned into providing that clarity to make sure that it's truly understood when somebody is a danger to themselves or somebody else, and they are not only articulate a means but an intent that we're able to get them help. When a crime has been committed or is about to be committed, we absolutely need to get an individual help to stop that from happening or to prevent that from happening. And then obviously when there's ever a threat of violence or danger or a crime against a vulnerable population, our adults or our juveniles or our elderly, that's all information that we are all as humans in the state of New Hampshire mandated reporters and required to get more assistance for those individuals and report that information to the appropriate entities. So when we created the statute in 2013, we really wanted to make sure that those things were very clear. But since we have evolved and we are growing, we saw the need to make it a little bit more clearer.
Yeah, so you're fleshing it out a
Yes,
little bit more, adding a little bit more description. Okay. Any questions? Okay. Gentlemen, thank you very much. Unless there's something else you want to add, I think that brings us to the end, and I want to give other people a chance get a few more minutes on this one,
Thank you,
if they
sir.
want to share.
Greatly appreciate your time.
Yeah, absolutely. Thank you for coming in. It's very helpful. In fact, we wouldn't have been able to do it without you. So, yeah. Did anybody else want to share anything on this? There's quite a few of you guys out there. No? All right. I will close this hearing or whatever discussion on 1079. Let's take just a couple minute break and we'll come back to do 1358. All right, let's back at it, guys. A lot of work today. Gentlemen, if you guys would just like to join us at the table, there's nobody else, so we might as well be friendly. It'll make it easier. I'm going to start with Representative Brown. He has given us an amendment, and why don't you walk us through that?
Okay. So, apologies, it's not in format yet. Been working with, OPLC and with the Deputy Adjutant General to come up with an amendment that worked for, both of them and for the sponsors of the bill. So, I've given you the original bill, and I've handwritten in on there the changes that are in the amendment, try to make it easier for you to track. The amendment with the red is actually at OLS now, and I told them when we were done today, I would go down and give them the last comment so they can draft it up properly.
Do you guys have one to look at? What he's talking about?
Yeah.
Okay, cool.
So I was not here for the original hearing because I zoned it and I was in exec session at Fish and Game as the clerk. Fortunately for me, Daniel Popovici Miller was here as a co-sponsor. He said he goes to hearings for bills he co-sponsors, so I've got to give him credit for being here to save that. So, and I think originally the chair said she might have thought there was some feeling that the bill might not be necessary, and we can talk through that with the gentleman here. But I think now that we've kind of gotten this far, that we're at a good place with thinking that it's something that we should move forward with. So that kind of being where it's at, you have the version with the red lettering on is the amendment, and if you need to ask what's changed, I have it highlighted in the original bill.
So you added the one line on this sheet that you gave me in red under B. License shall include licenses, certifications, or registrations required to practice a regulated occupation or commensurate training and experience in a military occupational specialty as determined by the OPLC. That's added language.
Yes, and I added that, and I don't know if Attorney Osterhaus has had the time to really take that in, and he probably has a better idea for how to say that, I'm sure. Since I did that at 1 o'clock this morning.
Yes, well, I have one from you. I've got one from him. I've got stuff all over the place for this
Yeah, well-
one. So we'll wait our way through, and the committee members can stop and ask questions. Just yell at me if you got questions.
And actually, I would add to that, from the original bill to the amendment with OPLC, a number of the tasks that we gave to the Veterans Agency was suggested that OPLC should do that, which is why when you get to page 2 of the original bill, most of it's deleted and it's now incorporated in the amendment, or it's already in what OPLC would do anyway.
Okay. Yeah, and I believe that Representative Lekis asked that question during the original hearing about whether or not OPLC was doing some of this or should be doing some of this, or I think he asked that question. So
That's probably enough for me to start.
great, thank you. Would you like to make some comments on it, gentlemen? We're getting it for the first time, so I haven't had time to digest it yet.
You want me to go first? You want me to? Good morning, Douglas Osterhout, PLC, for the record.
Yeah,
The-
subcommittee. It's
yeah.
not. It's a
Oh,
big deal.
okay. Too formal. I get it. Take my tie off. Do you want me to address the comment on line B, or just kind of an overall statement?
Overall statement on it so that we can get an idea of where you are, and then
Yeah.
once we've done that, if you want to add in what you've done and what you'd like to see in there, that would be great.
So I think overall what we're going to see, the progress here is not necessarily going to be a speed up of the processing of the application on the OPL side, but what we're going to see is a streamlining of kind of what comes before that. So we're going to clarify what is required for licensure in the state and how that, the military service and the training and experience translate to the licensing here. And then what we're also going to see with the VLAP is licenses coming to the OPLC that are complete and ready to go, and they're ready to be processed. And when we have a complete application, I mean, sometimes our turnaround can be same day, and it's going to be less than 2 weeks regardless. so we can turn a completed application around very quickly. So I think that's where we're going to see the benefit from this statute, is sort of everything that predicates that application coming into the OPLC, and when it comes in correctly, we get it right out the door.
And so I see that that same changed language is in this amendment on page 2. 30 days after having received it. We don't have that same language that we did before, right?
Well, I think my concern in 1385 as it originally proposed was it has this language about
15 days.
10 days,
days.
and then we would need to submit something in writing and get approval if we have to go. And it deviated so far from 541A and shortened the lease a little too much, and it could have been problematic. I think the language in the new bill kind of allows us more reasonable timeframes to turn this over, and I
Just
think
for
we're
the
okay with
just for the subcommittee's benefit,
Sure.
problematic from the standpoint if you miss that deadline,
We
you
would
have to
have-
reject the
we would have
the
had
application.
no, if it was an incomplete or inaccurate application and we didn't get approval timely from another agency, we would have been forced to deny, in my opinion, and that makes everybody start the process over. So here we just extend that timeline a little bit longer, and we're able to turn things around without being put in that situation where it's yes or no on the spot.
Mhm.
So
Thank you. Yeah, thanks
Yeah.
for covering. Keep going. Anything else?
are we going to talk more specifically about the language?
As specifically as you would like
as
to talk
I
about
would
it.
like to.
I haven't had a chance yet, so
Okay.
I can't be as specific as I usually like to be.
Sure.
I'm just reading it.
Okay. The colonel is recommending that I address something right out front. Representative Brown came to us this morning and added on the last page of the document a section D. It says the rules shall be complete by XXXX 2025.
Yes.
You see that? I understand the impetus behind that, right? To make sure these happen. It is a little concerning because it's not necessarily in our control, and we have a lot of stakeholders we're going to have to work with in order to make this happen. If we want that sort of so from the LPLC perspective, we're going to start work on this, and this is something we want to have happen, and we're going to make it happen as much as we can. That hard timeline is always scary from an attorney's point of view, right? We missed that deadline. There's objections, there's stakeholder feedback we weren't expecting. Now we're out of compliance with the law. I'm wondering if we could, my suggestion was potentially make it file an IP or an initial proposal. That way we would still have that time to work. We hadn't discussed that yet.
No, and so backing up a little bit you have the law there.
Yes.
The 332. So when that was passed, and I'm telling you what Director Courtney said to me, so you're getting it secondhand, so take that as you may. So the intent of this was to basically have a crosswalk. If you're this in the military, you should be able to get this in New Hampshire. Whatever that is, doesn't matter. Could be electrician, could be a pharmacy tech. We went with medical initially, and Director Courtney said to me, well, we put this in the law a little while ago that all boards would have to do this in rulemaking, which is what it says in there.
Mhm.
But she told me, and you can fix this up as necessary, that most of them have either not started at all or they're not done, one or the both.
Mhm.
So yeah, I'll just finish up. So I have complete faith, and the director and attorney have told me that they will get to this immediately for all boards under OPLC. However, those that aren't, EMS, so again, if you're a medic, a corpsman, can you be an EMT or an EMR, a crossover? Apparently they haven't done those rules yet. There are some already in place where there's automatic crossover. So putting D in was for me to try to get those boards that haven't started this off dead center, basically.
so
So there can be a better way to do this. It's fine.
So you're going outside of OPLC there. You're doing all boards regardless.
Right.
Does that include the bar?
It would include the bar right now. The other issue with that is where it's placed right now is, oh no, this is under 541A. Yeah. This looks like it's amending 31016, which is specifically limited to the OPLC boards. Is that
I think, excuse me, my intent was on the bottom of that second page under number 4, for all of you on the bottom.
Oh, amend 332G7. Okay. all
Right, and that'll be more clear.
I'm more comfortable with that now. I thought that was actually put in because this is the first I've seen this version
Yeah.
too. So,
Okay.
I
I see what you're saying. So
yeah, I
we're
was
cutting
worried if that was
OPLC
in
out there, and we're switching it over to
to
got it.
everyone.
to
So,
anyone.
yeah, so OPLC
Okay.
will take all the boards that they have under their purview, but that leaves
That's
a
no, I just
few
missed
that EMS and the certifications under DES, wastewater and water and those kind of things.
Right.
That leaves them outside of OPLC. This doesn't change what they should have been doing, but
You're just giving them a deadline.
I'm trying to find a way to say, do it, however that is. I don't care.
So you feel more comfortable because OPLC is not on the hook. The board is.
Well, everybody's on the hook. So I mean, it's not completely alleviated. It's not.
I would say there are still implications.
Yeah.
I would still, those other boards that are not covered by OPLC, there are still implications if they don't get the rules done. And rulemaking, in my experience, my very limited experience, and I'm not an attorney, is an arduous process. It's miserable. It's a miserable process, right? Necessary and very important to protect the rights of both the citizens in New Hampshire and the state. But it's trying to get something done in a year of this magnitude may be very, very hard.
What would,
That's my,
what would your recommendation be for a timeline then?
I think the shall have submitted an initial proposal language gets it lights that fire and it makes people do the work, but it says, if we get bogged down and there's further conversation that needs to happen in the 541A and GELCAR process, we're not going to put anybody out of.
So for the benefit
Compliance.
of the subcommittee,
Sure.
once the initial proposal is filed,
I think then you would have.
where does the train go from there? Like, is it outside? Like, once it started, can it stop, or is it on the train to completion until it's done?
It can stop.
Yeah,
It can
okay.
stop, and that's the danger. And I also want to second that. I think one of the driving forces behind this is it is very true that this has existed in statute for a decade, and there has not been a lot of progress on it.
Mhm.
So,
Two-tier date.
that's an interesting. I mean, that's an interesting point. The other alternative is,
Two-tier date. Initial proposal by 2025, completed by.
and then extend that deadline out a little bit,
Extend the deadline out for a completion.
6
of it? Uh,
months even.
6 months.
Because
I mean-
more than a miserable process, I think it's the timeliness of,
Yeah.
of rulemaking that is the concern.
1 second.
I mean,
You're talking about converting MOSs to civilian specialties? Is that what we're talking about here? Is that why it's going to take so long?
I just, no, I don't think that's the problem at all. I think the problem is, I don't think that's going to be the issue. I mean, we'll be able to advise the boards and OPLC what military experience and training equates to. We'll be able to we'll be able to work with the board and kind of make those determinations. I just think that, and again, it was tongue-in-cheek comments about rulemaking. It's difficult, right? It really is. And that's my experience. It's not, so I think that it's just getting through the requirements, the legalese, getting through the requirements of getting the rules drafted. Sometimes it takes a long time. I mean, even the simplest rules that we proposed for the department, 2 years ago took 18 months to finish, and they weren't difficult rules. I mean, it was simple.
And I'm also referring to consensus building, reaching out to stakeholders, getting in public input for those kind of things, both from military expertise and also the licensees in the state. So just so we can work with people, just giving us enough time. And I might be right. I'm also advocating to be a bit overcautious here, so we don't find ourselves in a situation where we're in violation of the law. And I'd like to see that timeline extended just so that doesn't happen. And that's where I'm coming from.
Yeah. Representative Brown.
that Representative Boyd, that is exactly the original intent of what we were looking to do. And University of Washington has got a great crosswalk, and it's huge, because there's so many MOSs. It's mostly a military crosswalk about that says these MOSs equal this. The Veterans Affairs Office has something called Corpsman to IMT. So the VA created a position, intermediate medical technician, IMT, technician, I think, where if you were a corpsman, you can basically automatically be that. It's not quite that simple, but so that is kind of what we were looking for, and that I guess is sort of my expectation of the rules. I can't imagine the difficulty of writing that in rule language, but that's that.
Well, that's a good point. You talk of corpsman, so you're talking Navy. I happen to be Green Beret medic. I spent 37 weeks training, and I'm equivalent to a PA. But how is that going to be established?
And
Or rather than just a 8-week basic medic course.
right, exactly, sir. And I'm familiar. I wasn't a Green Beret, but I was 28 years in the Army, and I'd rather have Doc patch me up than go to the hospital, frankly. I mean, you live that, right? So, but again, I'm not talking about figuring out that crosswalk to find out if that training equals board licensing requirements. I think we can do that relatively quickly. It's the process by which we codify that in administrative rules that carry the weight of law over time. I think that's where it starts to take more time. We can figure those things out. I mean, there are systems Representative Brown referred to that exist. We don't even have to make them up. They exist. We can pull the crosswalk off the internet or off the American Council for Education, by which they advise colleges and universities to grant credit based on military service and military training. So we have the groundwork to get that done. It's really just the process of making sure we get the rules right to protect both the state of New Hampshire and the licensing boards and the citizens in New Hampshire. I mean, that's where it's going to take the most time.
Nice.
Representative Simon, if I could just make a couple of comments just
Please do.
overall.
Yes, please do.
It's like, this is great legislation, right? So if we didn't do it, we'd be okay. And if we do it, we're going to be great, right? So I would tell you that the department has a tremendous and robust relationship with OPLC with regard to licensing and military transfer of military training to licensure, experienced licensure. It's not as codified as maybe it should be. I mean, the department as it exists today and the requirements for us to do this in the department only came about in about 2020 in statute. So we're young at it. We do have a person on staff. Her name is Erica Webb, who does this. So we are colloquially in bed with OPLC to make sure that we can do whatever we can do to help veterans or currently serving members of the military get licensed. And OPLC has done a tremendous amount of work. One of the things that surprised me very recently was when COVID started, if you were an Army medic, or you were a medic in the military, you automatically can get an LNA license. Automatically. It's there, right? I think there's a 3-year requirement, but what a tremendous thing. And so we want to help advertise that kind of stuff because most people don't know that exists. So that's the first thing I would like to say. Second thing is we're working with Director Courtney and the folks at OPLC. They've got a request for proposal out to rewrite all of their administrative rules. And we're going to have input from the veteran perspective to make sure that we are considering military experience and training so that we can, as it pertains to licensing. So that's the second thing I would say. The third thing is, as I mentioned, we're going to use existing systems to kind of suss out how MOS transfers or military occupational specialty or Air Force specialty code or whatever we call it in the rates in the Navy, how that translates to licensing. And primarily we want to use the American Council on Education because they have a very robust system that looks at, if you were a medic and you were promoted to sergeant as a medic, and at that level you were expected to do these things in the occupational specialty you awarded, it equals this many credits towards a health degree. So we could take that and they automatically line up with licensing requirements. We could take that and make that work. Two last comments. We don't approve licenses. So it's like in this process, and one of the things we're very happy about in the rewrite of, and the proposed amendment that Representative Carroll's brought by is that there's no confusion, right? So the veteran himself has got to justify, the burden of proof on experience rests on the veteran. The burden to issue a license rests at OPLC, and our job is to facilitate that in the department, right? So we want to make sure that the veteran has a resource they can go to translate the requirements of the licensing to what they know, and we can get them in the right place. And the last thing I want to say is, we don't think this is going to create a tremendous increase in demand to the system, right? So of the boards that OPLC manages, just a cursory look without a whole bunch of work going on, we only think there are about somewhere between 12 and 18 boards that may even be relevant in this process. And we will look at the occupational specialties across the Department of Defense. We don't think that's a very high density piece. Most people in the military are combat arms, and the professionals, the logisticians and the medics, they're a smaller cohort of the military. So the people that might even qualify based on military experience is going to be small, just based on what's going on and the recency of the license. You're a doc. You were an A-team doc, but those skills have degraded. You wouldn't necessarily be comfortable doing some of those things today, or as comfortable as you were when you were on an A-team.
50 years ago?
Yeah. And there's been some advances in medical technology, right? So so even then, the proximity of, or the timeliness of your separation from the military is going to shrink that population. So we don't think this is going to create a tremendous demand on the system, but what it is going to do is create a tremendous opportunity for us to make sure people have an ease of getting licenses. And everybody benefits from that. Employers benefit from it, electricians, plumbers, medics, everybody benefits from that. So it's a good thing that we can do. But I mean, the floodgates aren't going to open. We're not going to see 1,000 people request licenses. We might see 40 a year, just based on population. So those are the things that I would kind of mention.
Representative Schmidt.
So I think your remarks just now are very, very important for us, because otherwise it's a black box. We don't have any idea what's in there, how it would work, what impact it would have. So knowing that it's 40 and not 1,000, and that's very important for us to know what we're loading on our back or not. So that's very helpful to me, and I'm sure to everybody else as well.
Okay, I've had a chance to read it. It's helpful. No, it's perfect. And I heard what you said as well, so it's okay. Representative Brown, nice job catching the executive director thing in paragraph 2 on the second page. Yeah, okay, I was gonna say that like literally jumps off the page at you now. It's like, wait a second. Question, Mr. Osterhout. Where was it? We have a reference to this for temporary license. Should we change that to conditional license? So paragraph B, page 2, the applicant must submit a notarized affidavit affirming under penalty of law that the applicant is a person described and identified in the application, that all statements made on the application are true and correct and complete, that the applicant has read and understands the requirements for the license, certifies that they meet those requirements, and the applicant is good standing in all jurisdictions in which the applicant holds or has held a license, or is not subject to discipline in jurisdictions. That's not even the one I wanted. C, the next one is the one I wanted. The applicant may request a one-time 180-day extension of the temporary license if necessary to complete the New Hampshire licensing requirements. The applicant must make the request within 15 days prior to the expiration of the temporary license. Do we do temporary licenses anymore? Or did we change that to conditional license? Conditional license.
So there might be some confusion on that. So temporary license was a big thing during COVID, right? It was to get workforce right in the door. Conditional licenses have a similar purpose in that we can get somebody working without having to wait the 90 days for their criminal background check pending other protections in place. So
Which seems like that's what you're doing here.
it is what we're doing here, and that might just be
Actually, that's where it is. It starts in A. The applicant shall obtain a
yeah.
temporary license for a period not less than 180 days while completing the requirements for licensure in New Hampshire, so long as the cause for denial of a license exists. No cause for denial of license exists under this title or under any other law.
under 31016, that whole section is about temporary licensure.
Okay.
I think from a practical point of view, depending on how that plays out in the rule, it can sort of refer to one or the other. So there might be instances where conditional or temporary might be somewhat interchangeable. I don't know if that's 100% accurate.
If you can find out what the better word is,
Yeah,
so that
I-
if we do this, we put the
I
better word
can-
in.
I can take a look at that and then see which word we want to put in there. Applicant may request the one-time extension of
Rep.
temporary
Simon?
license.
Yes, Representative Brown.
Thank you. So, yes, the change, that entire piece is in there, but the change was the addition of 2 and 3 in bold below that. And it was included because you had to change Roman numeral 1, 2, and 3 to Roman numeral 1, A, B, C, D.
Right.
So that's why that whole thing, I don't need to tell you that, I guess, I'm sorry.
No, you're good.
But our intent with this was not to ask for a temporary or a quick license. It was just to ask for a fair process that doesn't make a veteran take courses and take an exam that they shouldn't have to do. That's basically the idea. So, I would ask the gentleman at the table, the reason on the first page that I added commensurate training experience in a military occupational specialty is because I didn't see it specific. I wasn't sure if it was specific in the new 2 and 3 on this page too. So I just want to be clear that somewhere the veterans we're talking about are not included in Roman numeral 1, spouse temporary licenses. So I want to make sure that it's clear in the words that where they are included. And I thought I had added it to either 2 or 3, but apparently I didn't. I think I might have thrown that in one of
I
my
think
100
Mr. Esterhout
emails.
can probably help you there.
Yeah.
So sometimes I'm better than myself, and I looked at my notes from the other thing. I do think looking at C now, that should stay temporary license
It should
because
stay
it's
temporary.
referring specifically to the temporary licenses, and that was not a change that was part of the amendment. There's a little bit of redlining in what is already existing statute in here just to clean up the language of 31016.
Okay.
If it doesn't happen, we can live with the language as is, but that was kind of tighten up the language thing. Just a recommendation while we had it open. So I do think that piece should stay temporary license.
Okay.
There. As far as the definition, there is a concern about putting or commiserate training and experience in a military occupational specialty as determined by the OPLC in the very definition of license, because to me, I think the argument could be made that if I have that training, there's no reason to go through the licensing process. So I like that language. I don't think
Just not there.
not there. Yeah. Where we want to put that, I originally had bracketed the new section 3. I think it could also fit right below that. I'm on page 2 in that amendment to 332G74A. I'm wondering if it could fit there. But if you want it in 31016, I could play around with it. But my gut reaction was Roman numeral 3, the new proposed Roman numeral 3.
Okay.
But
Yep.
I'd want to look at that more closely because this
The
morning's the
proposed
first time I saw
Roman numeral 3, meaning what you gave me.
were correct.
Yes. Okay.
So it reads the executive director shall, in consultation with the boards, councils, and commissions.
Yep.
So that fits, right? For what constitutes military education, training, or service acceptable for the specific regulated occupation. And it seems like this commiserate training and experience fits right in with that section 3 there.
Representative Rhodes?
Yes, I agree. But that falls under because it comes under military service members and spousal temporary licensure, does that negate that? Am I reading it wrong, or am I thinking way too hard?
Say that again for me. Sorry.
So the new Roman numeral 3 is still under the title military, at the top of the page, military service members and spousal temporary licensure. So a person who has gotten out of the military is not a military service member nor a spouse.
So that might be a good time to change the title of the section of 31016 to make it a little broader and just have it Office of Professional Licensure and Certification, military service members and spouses. Take out temporary licenses from the title, then we have it, 1 kind of addresses the title and 2 and 3 sort of address the long-term rulemaking that we're talking about here, or the long-term licensure that we're talking
Yeah.
about here.
And
We just clarify the title a little more and we expand it to 2 and 3 by removing those temporary licensure words from the
Yeah.
the top there.
and I know that you know what I'm asking for, but it still doesn't say that this is for what's the right word? A separated, after someone is initially out of the military,
Honorable,
a veteran, just a veteran. It doesn't say that.
honorable discharge, or
I mean, it says it in the, well, it does say it at the beginning of the entire change to the law. It's the veterans license program. So maybe it's covered there, but does that make sense?
Yeah, I think my reading of it is it's sort of implicit in
Okay.
that we're talking military education, training, and experience on its own. And so I read it implicit in that statement, even if it isn't explicitly there.
So-
I don't know what other. Sorry, go ahead.
No, I cut you off. So I would say it's not important that they're separated or serving. What's important is they have the training, right? So the status of the veteran here is less important than they're able to, they have the burden of proof that they have the training on them, right? So if they're still serving in the Guard or the reserves and they have the training, or if they're separated and they have the training and it's current in accordance with the rules, then I think that's more important that they can substantiate that they have the training and experience than it is what their status is currently serving a veteran service member.
that's a good point. There's no reason why somebody who has the experience and is still enlisted shouldn't be able to apply for a license and receive one, is there not? So you can plan ahead of time. You know you're heading towards retirement and you want to make the change. You can get the work done before you're actually in the situation and then just seamlessly walk over. Does this allow for that?
We can do it in a roll, I think.
Okay.
That's what this would allow for.
Okay.
And again, I'm not a lawyer, but it doesn't preclude it.
Right. No, I wanted to make sure that,
Yeah.
I wanted to make sure that it was that. I think that's a fantastic way of going about it. So I just wanted to make sure that that was an avenue that we could,
So- And
Go down.
mostly in New Hampshire, right? So in terms of population, again, back to Representative Schmidt's comments earlier, is we don't have we only have about 1,200 actively serving non-reserve members of the military in New Hampshire. Most of them are recruiters. They work at New Boston Track and Station. You know, there's not a lot of actively serving regular guys. Everybody else, to the tune of about 5,000, are in the reserve components. So they're currently serving, they're currently performing, you know, that 1 weekend a month, 2 weeks a year, if they're not deployed, their military mission. Like flight medics, you know, the guys who pluck the, you know, hikers off out of the White Mountains and the helicopters that we send up there, those guys they're absolutely licensed in the National Register of EMTs, licensed. They are. So, and, you know, electricians, you know, some construction engineers, plumbers, they can do that. So again, not to belabor it, you know, the horse kind of turned into glue here, but
that's our job.
right. So, but it's more important that they can demonstrate the training and experience than it is what their status is in the military. And in this particular case, I believe that.
Mr. Chair?
Yes.
So would it be simple just to add the word veteran in the title? To shut me up?
We can do
So, and the term of art, that-
Veteran or active duty, though. I mean, or maybe not. Maybe that's. We could.
It says military service member, right? Veteran, military service member, and
Oh, okay.
spouse.
the term of art we use in the department is service member, veterans, and their families.
There you go.
Yeah. Let's do that. That sounds. Anybody else? Concerns? You got that concern look on your
Can-
face there, Peter.
Well, to me, the concern is that if we
Mike.
have people out there
Peter.
that are,
Mike. Mike, real quick.
sir.
That's all right.
if we've got people out there who could be gainfully and beneficially doing something to benefit themselves and also people in the state of New Hampshire, and the only reason they're not doing it is because they don't have that little check mark or whatever, then we're we're wasting an opportunity, and we're also not only not benefiting, it's not only that we're not taking the money off the table, we're polluting the situation because those are people who could be doing something, and it's potentially messing with their minds that they can't do what they want to do, and what they would benefit. Everybody wins if we do it. So let's get on it.
Let me follow up on that. That's a great point, Representative Schmidt, and I think these guys have both heard the story. So let me give you the 2-minute story where this came from. Our son, as a senior in high school, said, "I want to be in the Navy." He did his early entrance for the first year. He went off to Great Lakes, graduated from his basic training September 13th, 2001. So we knew where he was going to be going right off, right? He did 3 tours in Iraq. He was in the square the day in Baghdad, the day the statue came down. So he was with the 3-4 with the Marines. Then throughout his 14 years, he was a pharmacy tech for 3 years. He worked in the hospital in primary care in Naples, Italy for 3 years. So he had a number of experiences, and I showed you his, I think I gave you his, tell me what it is. List. It's the military list of your experience. So 10 years ago, he got out, and we said to him, "Well, you should be able to be an LNA or something like that." And he said, "I can't." He said, "Unless I go to classes and take a test." And you know, between all of us here, it's not for everyone to know, but he came home, as Representative Schmidt said, he sat in a funk for 6 months because he really wanted to stay in, but that's another story. But so that what your point, that I'm agreeing wholeheartedly with your point, that some of these people that get out of the service, that was their life, and that's what they want to keep doing. And I think that's the point of this, to bring in those people that have that public service already, that dedication to public service. So thank you. I appreciate it.
Because the alternative to a win-win situation is a lose-lose situation, and that makes no sense. So I've been out for since 1958. So it was. I don't remember everything from those days, but I do remember MOS, and my MOS was what was it? Riflemen. Right? Marines are all riflemen. But the point is that when somebody used the word corpsman, I'm going like, bing, I remember Doc Hornback, who was the corpsman attached to my unit. Now, I have no idea what his training was, but when we had anything medical, we got Doc Hornback in and so forth. And so that's a term of art to me. And MOS is a term of art. So those things all mean something. And to the degree that this MOS means the same as LNA or whatever, and we're not letting that person do that, that's a lose-lose situation. And I'm sure your son was going like, "Oh, that's not good. Have him sitting around."
But the good end of the story is he ended up working at the VA hospital in White River, and he's in Tilton now, and he was used in the emergency room during COVID. So it's all ended up very nicely. Happy to say.
But the magic word here was commensurate training and experience, right? In red in that thing. So to the degree that they are commensurate, then let's get at it.
Can I make one more comment? Because I think we
No.
are talking about 2 different classes of licensee and applicants here. And I'm looking at the red line on the first page, the commensurate training and experience. I'm not sure Roman numeral 3 on its own is sufficient, which is why I'm struggling, because you're going to have individuals under the OPLC and individuals not under the OPLC. And we want to make sure that language applies to everyone, not just, it seems to be the intent. So it might be worth putting that language in two places, not just
Sure.
that definition. I just want to
Yeah, no,
flag
that's
that.
good. Okay. So you're saying 3 doesn't cover OPLC as well?
3 would cover OPLC. It wouldn't cover people outside of the OPLC
Okay.
because 3, that Roman numeral 3 is a modification of
Oh, yeah, yeah,
310.
yeah. I'm sorry. I was thinking 4 for some reason. 4 in my head.
So maybe that's why I was struggling because maybe it should be in both.
Yeah, would you? Okay, yep. Yeah, because 4 is when we break out to 332G, right?
Right.
374.
So I just want, if we want it applicable to everybody, let's put it
Okay.
in 2 places.
Sure. So the third page, we never really came to a conclusion on what we wanted to do with that as far as the date. I understand the desire for the date. I'd like to find something that's somewhat acceptable to anybody. How do you feel about an initial proposal by 25 and then finalized rules by July 1st, 2026?
I mean, I'll defer to the expertise of all of you in the room. I mean, I've been involved at DES with rules, and it's a solid year.
Mhm.
If you're lucky, I guess. I mean, there's an official timeline that that's put out, but so I'm okay with
Okay. Yeah, I mean, I guess
anything to just move this off dead center is the
right.
idea.
Yeah, exactly. I was gonna say we've never done it, so a year and a half from now is better than 2 years from now is better than never. And with that's not to say that we wouldn't get those rules sooner. Just like if you light the fire, sometimes people are like, "Oh, we've got a deadline. We better get moving." They might get them done faster than the deadline, but we just don't want to.
I agree. IP 25, final rules 26. It's great.
Well, in addition to have some certainty, as opposed to human mind does not like uncertainty. And to the degree that well, I've got a week or a month or a year or whatever, at least it's something. But we got to make it that means something, so it's not just your promise will be done in 3 weeks and it doesn't happen. So
And I would also argue that, based on the relationship we have with OPLC and the department has with what they're doing, we're going to be doing this before the rules get published anyway.
Mhm.
Right. So if we can facilitate the license absent a requirement in a statute, we're going to do it. And so we'll be okay.
Yeah, and I find myself doing this more and more, and I don't know if I should be, but I'm making sure other agencies have an opportunity to know this is coming and give them an opportunity to get eyes on too. I think from the OPLC perspective, I agree. This is something we want to do, and we're going to get started right away.
And actually, Mr. Chair, that's a question I have for you. So, because this addition to pushing the non-OPLC boards to do this work has just been put in here, no one knows on those sides that this language even exists. So, is that okay?
I mean, as far as public hearing, they wouldn't have had a chance to
I
weigh
guess
in.
I guess that is what I'm asking. Yeah.
The original
At least-
one,
Yeah, at least
only-
an opportunity to comment is, I think.
yeah, the original one only dealt with OPLC, correct?
Right.
The original bill. So yeah, that would be that. We can't do that. We'll get slapped for that one, I'm pretty sure.
So, from a timeline perspective, what do you want me to do, or what do you want to do? It's not my bill anymore; it's yours. But
Well, technically it's ours because you're still on this.
It's ours.
Yeah, Mr. Osterhout.
I think we could do the section 1 and the section 2. I
Yes.
wouldn't, right? That wouldn't be non-germane.
That's-
It's the
yeah.
section 4 here that we're,
Section 4 is the one I'm questioning.
because those numbers are a little backwards. Yeah, that should be 3 and then 4 and 5. I'm just talking sections now. I'm
Yep.
getting nerdy here. Sorry. So just the section 4 would be the piece that would be problematic.
I think so.
Okay.
Yeah,
But the OPLC
without a
piece-
public hearing on it.
that's what I was last night when I was writing this. I was thinking I don't know how it works.
Yeah,
So
I think Peter, would you agree with that? It's outside the scope. we didn't give the other boards an opportunity to know that it was coming and participate in the public hearing. That's probably outside, that would probably be non-germane. You have more experience than I do.
Yeah, yeah. Well, we don't-
Yeah.
sure that-
Or someone does it next year, or
Or we
well,
take
all
a
that-
Senate bill and attach it to that, or we could, I mean, we have options still ahead of us. It's
Okay.
just, so here's the trick of where we're sitting as a committee. We have an exec session on Wednesday. That's supposed to be the last exec session. I'm sure the chair would like for that to be the last exec session. We start throwing in more public hearings, we're gonna have another exec session for one bill. Everybody's gonna have to come in for. There's always the possibility of asking the Senate to amend, and if we're amenable to it ahead of time, it'll be an easy concurrence at the end. You just always want to be careful that it doesn't get screwed up doing it that way too, but that's an option. Then we could just concur with it, but then that would have the opportunity for a hearing on the other side, and I think, or no, we would still have to bring it back here, wouldn't we?
Well, yes. If they do something that we haven't done,
Yeah,
then we would have to concur.
concur, but we wouldn't have to have another public hearing on it.
No,
Yeah.
no. If there's been a public hearing on one side.
One side's good. Yep. Okay, that's what I thought. So that
Right,
would be an option for you.
Okay, so my goal would be not to derail us in any way for this year, for this session, to move forward. So, certainly if you have an idea in the, before next Wednesday, whether we just pull that out and try to amend that next session, which pushes it 6 months farther out for those other boards.
I think we could probably get Senator Pearl to agree to amend this in the Senate.
I think so.
I don't
I'm
think
sure
it
he
would be
would.
hard at all. So if we took 4 out here, got it through the House, and it goes to EDA and EDNA in the Senate, we'll just talk to Senator Pearl when we figure out where it's going and just say, hey, we're going to do this. We need your help.
We have to make sure that's going to happen.
I did get a senator on this, hang on. Senator Birdsell, who I've never spoken to, so I don't.
She's easy.
She'll do it. Yeah.
I got.
But Pearl's the head of EDNA over
Oh,
there.
got
why I
it, got
said
it.
so.
Okay,
Yeah, yeah,
thank
he's
you.
chair of
EDA
EDA.
committee chair.
I
Right.
told you guys know more than I do, see?
But
We're here to help.
If we need Senator Birdsell to sponsor the amendment, that won't
Yeah.
be hard. That I could talk to her. That won't be hard.
I'm really not seeing any of it as a problem. I'm sure it'll probably, like, there are times I'm like, I don't feel that way about this.
I agree, but the thing is, we have to make sure that it does happen.
Yeah.
Because I don't want to hear anything about next session. We're ready to do this right now.
Well, we can have a conversation as a committee too at some point about whether or not, if that were to pass in the Senate, we're going to be okay with it, just to get a pulse for it. So, and worst case scenario. So here's what I would say worst case scenario is, honestly. We amend the language in the Senate. Senate asks for concurrence. For some crazy reason, the House decides not to concur with it, but we go to a committee of conference. There's no way we're not concurring without a committee of conference. We go to the committee of conference. The House says, listen, we just can't do this. And the Senate says, well, we don't want to toss the whole bill. So we'll just strike our side and we'll concur with you. That's worst case scenario. I don't see anything other than that happening. Either you end up with the language that we've got or the full thing, but I don't think you end up with nothing. I just don't see that happening.
Thank you all. So would you like to make those few changes and send that off to me, or before? And OLS is waiting for, he's waiting for whatever changes that we might want to make, if you want to, on the date, or I can do it. It might be
I
better
think
written if you do it, not.
the
not-
only recommendation we're making is just to, I've got this bracket here, just take this one section out. If we said that to OLS, just cross that out, everything else can go as is.
Say it again, sorry.
Right,
Take
I
out-
think the only recommendation we're making here, well,
Move the language out of line 3,
we,
or the definition.
so
of
we
license.
want them, actually, maybe it's easier if I just add the language and send it to you today.
Okay.
Okay.
You want to be copied on that.
Yes, please.
Is that okay?
Yeah, that would be great. Any concerns from the committee or anything? Anybody else want to be tagged on it?
And Mr. Chair, I have one more question for you.
Please.
If you all look at the original, on page 3,
Yes.
where it's deleted line 10, 11, and 12. I'll wait for them to catch up.
The insurance component.
The original bill, page 3, line 10, 11, and 12. So this was a team effort. There was 10 of us working on this originally. So everybody had a bunch of different pieces, and Representative Dunn came up with this piece about insurance, making sure that somewhere someone talked to him and said, if this licensure happens, I think it was because if it happens more quickly, will these people be covered by insurance? And I believe Director Courtney has looked at that and talked about it, but I want to make sure that we're all on the same page, that we don't need to state anything in that fashion.
Well, oh, about the examination or test component of it.
So we've probably fallen outside of what that sentence says now, but where we've ended up, right?
You're saying because we're providing the license without potentially having to do the examination. Do you know of an instance where the insurance requires the test? I mean, if they've got most of them care about license, right? They care that they're licensed. I mean, they're looking. I think anyway, most of the time they're looking to the state to determine whether or not they're just looking for a stamp of approval that the state has looked at them and said this person can practice.
Okay.
I think, but I've never heard of them.
Okay. And it might
requiring-
be, maybe in the earlier parts of this, there was some thought that it was an accelerated process, or that in some way it might have been not as equal of a license, maybe. So I just want to make sure we're okay getting rid of that.
I
that's
think so, because the force of law is behind it either way. We've looked at it and said this is an acceptable form of licensure in the state of New Hampshire, whether it's temporary or the full license. This is how we've defined it. I've never heard of an insurance company denying a licensed individual insurance because they didn't pass some other arbitrary exam of some sort.
And I would say that I'm very careful to say this, right? Veterans deserve a chance. They deserve an opportunity to compete, but they don't deserve a free pass.
Right.
So they still have to meet the requirements of the license to get it. So, I mean, I understand the issue that some insurance companies may be reluctant based on what they might think the license is, but at the end of the day, there's no expectation from the department, and there should be no expectation from the veteran that they get a license that they're not otherwise qualified for. So they're not, OPLC is just not going to give it out because they're a veteran. I don't know if I'm making any sense.
No,
to
I
you.
do. But it brings up another question.
You're right, I think.
Yeah, it brings up another question of, is there anything in this process from the OPLC side of things that they see commiserate experience? However, they still would have to pass this exam according to the board in order to get the license. Does that exist?
I would say that's possible, depending on the license.
Because the board still has the right to set the standard for the license, correct? So if the board requires the examination, they may have all of the other credentials, but I would assume they would still have to take the examination to get the license, which they should be able to do if they actually have the experience.
I agree with you, right? I
Yeah.
mean, but again, I mean, I made it clear that our department can't make those determinations. Only just kind of get.
Well, and that's also something this allows us to establish in rule,
Mhm.
so we can do whatever we want.
Yeah.
At that point, right? As far as
Yeah.
to your point, setting the criteria for licensure. If they want the examination because we need that, then we can set the examination in rule and make that a requirement.
But that's going to be the recommendation of the board, correct? I mean, the board's going to look at it and say, I understand the military personnel has all of this experience. We're still going to require them to take this examination.
I can't speak for the boards, and there are 57 of them,
Right.
or even if only
No, I'm just saying
18,
if
but
the board came to you and said that then
Right,
the military
right.
personnel, OPLC wouldn't be able to override the board's opinion on that, would they? So the board says we want them to take XYZ examination in order to be licensed, even though they have all this commiserate experience. Could OPLC look at them and say, nah?
no, I don't think that's
okay,
going to happen.
I didn't think so.
Yeah, and
So
right in this consultation with the boards, and I know there's always this question and this tension about the final authority. So I see this as, I mean, it's the same arguments I make often with advisory boards and 313 and those kind of things. It's that this is not happening without consensus and working with the boards.
Right.
Now, are they going to get what they want 100% of the time? I can't guarantee that, but we have opportunity for public comment. We have public meetings. We have the jail car and the administrative 541A process. Like, there are controls in place. So if the board comes and says, in order to be able to do this, you need to pass that examination, that is not going to go unheard.
Representative Brown?
So our goal in a perfect simple world would have been reciprocity in essence. That's
Yep.
if you're this, you're this. You don't have to take classes or take a test. That, I mean, that was the original intent.
I agree. I think my question is more. It was more a question asked to disprove the assertion than anything else. I'm not sure that a board would require an examination. Like you said, there are 57 boards, though. There might be some occupation out there in which the overlap isn't perfect between, but they just said it's close enough that if they can pass this examination, then we can give it to them. You know, that was the only thing that was going along in my mind. Otherwise, they would have to deny because it wasn't commiserate. But they might be able to look at it and say, well, it's close enough. If they can just do this one extra thing, then we can give them a license. And my question was just simply, in a situation like that, OPL's position is what? And it was what I expected it to be, because we've been doing this long enough.
And I could give you kind of an example based on some legislation that passed last session, right? So we passed, the general court was generous last year and passed some stuff at the direction of OPLC, that if you had 8,000 hours of electrician experience in the military, you automatically qualified to be a journeyman electrician. You didn't have to go through the apprentice license, right? So that's good. That's a great law. But what we did find was not necessarily pushback from the boards, but pushback from the electricians union, right? So they're not necessarily enamored with this, because now they lose control. The union lose control of the training process, right? Good, bad, right, wrong, or indifferent. This is not an indictment of anybody. So there may be some.
Half of us agree with you and half of us disagree. So that's okay.
I knew that was going to be. Isn't that the way? That's what I said. When you run for office, half the people automatically hate you, right? That's how it works. So you know, I'm not. You know, it's really not an indictment of that process. But I'm just saying that there may be some instances where the boards would say, "We want to be sure," or there is some pressure to the board from external sources that say, "We want to be sure." So I don't know if it's going to, you know, what the law says one way or the other, but it's not necessarily just a done deal, because there'll be some people who are really for this and some people who think it's bad for the system.
And you know, the beautiful thing for us is at that point, that's up to rules and the boards until we get to jail car, and then they can deal with it. But I'm not on that yet, so.
Stay away. And the other thing, the point I like to make is, I think underpinning everything OPLC does is protection of the public, right? And we do a disservice to the public if we let somebody who isn't qualified get that license. And so we have to go to these subject matter. There's no escaping it. We are interlocked. And I think that really needs to be highlighted, how much we rely on each other. And this isn't, I just want to put that out there,
Yep.
right?
So-
That is our goal.
Bringing you around full circle, I don't think you need that section, because I don't see that as being a hindrance in any way. I don't think that the insurance companies, it's a robust enough system. I think the insurance companies are looking for licensure. They're not looking for anything else.
So I think, from my perspective, I think we've covered everything we were looking to do. I'm really heartened, and gentlemen, thank you really so much. That I think that having the Veterans Agency sort of be the first focal point, and if someone's struggling to get through this process, that you guys can provide them both actual emotional support and the whole thing to get through the process. So I'm really heartened by that. So.
I'd just like to say that this is 60 years too late.
Yeah, I never mind. We can talk after.
Well,
I love Doc.
I'm feeling pretty good, because this is day one for me. So I mean, if it's 60 years too late, and we're getting it done right now, I'm doing pretty well. So I'm feeling good about that.
I love Doc. Doc's the best guy on the team.
All right, guys. So I think we've got a good working order. So I will let the subcommittee know now. I'll be scheduling a subcommittee meeting Wednesday morning at 9 a.m. because we're going to have to go over the finalized amendments for the stuff that we're looking at today and give our approval to it before exec session starts. So just heads up, Wednesday, 9 a.m. We'll be looking at the finalized copies and hopefully we can come to an agreement on it and push it forward to the full committee.
Would you like us to come back for that?
If you're concerned about, like, if you've seen the amendment ahead of time and you're good with it, your absence will communicate to me that you're good with it.
There won't be any surprises.
Yeah.
There really shouldn't be any surprises.
I don't know. I've seen some of the stuff that comes out of OPLC and some of it's 120 pages long with all kinds. No, totally kidding.
198 page omnibus bill coming your way.
All right, I'm gonna close the session. We got lunch until 1 o'clock, and hopefully some of you are still here because I need at least 3 people. Huh?
What are we doing this afternoon?
11:35 and 14 or 11:58, 11:31, and I think it's 13:58 maybe. I don't remember. I've got to look. No, this one was 13:85. It's posted outside. I don't remember.
we have the bill that we need?
We have a quorum, right? Yeah, we do. Well, yes. So we're looking at Bill 1413 and Bill 1131. If you have those.
No.
Do you have them? You're gonna pull it. 1413 and 1131. I don't have any extra copies. They're really simple. If you want to sit here, I can share.
They always say that. Simple bill. Yeah, right. Common sense legislation.
Let's do because I think it's probably the easier of the two. Let's do 1413 first. Wow. Representative Gregg, if you would care to join us at the table, that would be fantastic. That's weird.
Is that it?
No. So 1413 just repeals a section. It's pretty easy, and we're mostly going to be focusing on. I'll turn it sideways so it's bigger. On B, this section here. Okay, so 1413. If you could just walk us briefly through what you're trying to accomplish with it, that'd be great.
Believe it or not, I'm still trying to pull it up. I apologize.
That's fine. We're not in a hurry, and Carol is on her way, and
Okay.
the more you delay, probably the safer for me.
Okay, that's good. Okay, so 14, I'm ready if you're ready. If not, we can.
I'm ready.
Okay, so what I presented actually redacted the entire section because when first posing what I thought was going to be a quick fix to the Office of Licensure, they actually wanted the entire section redacted. They were going to put something in requesting that because they think it's duplicative. After listening to the hearing, I actually think maybe it was going to do things that I didn't intend it to, or where they were saying that, well, when you take this section out, it kicks it back to the regulations on conditional licensing, which I agree with, but I certainly don't want to put anything into legislation that's going to be confusing or that's going to seem like we're trying to take shortcuts when it comes to licensing, because that's not it. So the big thing that what I started with was there's an older part in this where it says that the supervisor must assume both professional and legal responsibility. Now this is back from like around 1980. So almost every one of these, whether it be social work, all these used to say and legal, all of that language has been removed except for on this one. The complicating factor is with, a litigant heavy society is that saying that you're legally responsible for another adult is a complication. So I just wanted to remove and legal. And if there's a better way to do that, that would be great. But, the problem is we can say it's hard to get supervisors. There are literally private practices that are having a hard time getting supervisors because they see this and legally responsible. Well, that means if I'm legally responsible for somebody I'm supervising, they go out and get a car accident somewhere else and it's not specified, then I'm legally responsible then too. So I think it's a little bit of a miss as our language has evolved. So that's what I'm posing now. We can either look at redacting that entire section if you guys think that that's the way to, or we can just look at that particular problem thing that was bottlenecking part of our supervisors.
Okay, yeah, I mean, I think with both of these bills, we're running into perhaps a similar problem where it may actually be the interpretation of the medical, psychological profession that's causing the problems more than any true legality issue where anybody's actually going to pursue that kind of legal action. But I know we've talked already about for the subcommittee, my recommendation for this, because the only thing that they seem to be really concerned about is that these supervisors wouldn't be legally responsible for things that happen outside of the practice, was to just take the language from actually 1131, the bottom of it, and just say that they're only responsible, they assume the professional, ethical, and legal responsibility for such mental health services. So they're only on the hook when they're providing the actual mental health services, and I think that would probably.
I think that's fair, and I think it also makes it complementary in the two different areas, that we're
Right.
not contradicting each other, that it's keeping it pretty similar.
Consistent. Yes, Representative Gerhard.
Thank you, Chair. Maybe I'm missing something. If you're only liable when you're actually providing the services, if somebody was to receive advice from the professional and then go do something, is that considered, you know what I'm trying to get at? What point does it not become during the service? Do you follow what I'm saying? If somebody was giving them advice and they go do something, can they say, well, that guy told me, you know? Does it make any sense, or I'm totally missing the mark on this?
Oh, I think that is I mean, you might be able to shed some light. I'm not saying it's your area of specialty, because it's not. No, I think that's the point, is you're providing, the service is advice, and, you know, that's what I'm saying. If you said, go do this, go shoot your mom, that'll solve the problem. You're going to be liable for telling them to go shoot their mom. If you say, hey, you've got to work this out with your mom, and they go and shoot your mom, then, you know, the psychotherapist isn't going to be on the hook for that. They never said to do anything of the sort. That was the interpretation. So I'm assuming that in there lies the differentiation. But by saying, while they're providing the medical services, you are liable for that. If you do harm, you're liable for the harm that you do. And so that's where the judiciary would come into effect.
But at a certain, there is no record of any of this. I mean, there's no record of a petitioner telling their client anything. It's all done in confidence.
Right.
So wouldn't this is just I mean, it's no point even. Anyway, okay, I'll sit
Well,
back.
I think what this does too is it narrows in from just saying like, you know, I'm legally responsible, you know, just in general, which could mean anything. Once you're legally responsible, like I'm your supervisor, so I'm legally responsible for you. Well, that's a big thing. Now, I'm legally responsible for you when you're in the workplace and you're doing the things that are within your scope of practice. Then that's kind of narrow. That's like a medical malpractice versus just being legally responsible.
Let's
So what defining
drugs,
more?
like if they prescribe drugs, and the prescription's terrible and the person dies, or that might be an instance where they would be held liable for their malpractice, because some of them can, I believe, in some instances do that.
And in these supervisor agreements, they're signing this. So they're signing like, yes, I'll be responsible, or yes. So,
Yeah.
you know, so the problem is some of them are not wanting, they're stopping and going, wait a second, I don't want to sign this if it says I'm legally responsible for somebody and that's it, you know, because then that, you know, unfortunately, the way that some things get twisted and stuff, sometimes somebody could say, well, you're legally responsible, period. Because, I mean, there are people that get injured and, you know, of course, the reaction is to go after everybody that they can, depending on how big that grievance is. So it's just protecting the people that are signing on to be supervisors and narrowing it to what they are specifically supervising.
Anything else? Anybody else? That seems like it's pretty much the whole thing on this one, if nobody else has any thoughts on it, is just changing it so that instead of it saying that they're legally responsible, that they would be responsible, they're assuming the responsibility for the professional, ethical, and legal responsibility for such mental health services. We would just be putting that in to clarify what they're responsible for. Does that make sense?
I agree, and it's already language.
Are you comfortable, Jason, or are you uncomfortable with this?
I'm personally not a fan of licensing in general, so, but yeah.
Licensing is theft. Is that what you're saying? Yeah. Hello. Welcome. So,
Very sorry, I'm late.
no, that's okay. So, we were just looking at 1413. Sorry, I got a frog in my throat all of a sudden. And going back to 330A 22B here, the only real concern that they had was this idea that the supervisor would be legally responsible, because they thought the term was broad and might go past scope of practice. So my recommendation was to just take the language at the end of 330A34. They assume the professional, ethical, and legal responsibility for such mental health services, so they're only responsible. And I think that pretty much cleans that one up. Your thoughts?
I agree that it's, I don't want to take that section out because I actually worked on it to make sure the supervisory agreements were agreeable to all. And so
Yeah, so that would leave everything in place. It would just clarify that one point. Does that sound good?
I'm good.
Okay, so now for the more fun one, which is why I asked Doug to be here, even though it's outside his scope of expertise. So HB 1131. Why don't you tell us again why this bill was brought forward, and then we can have a discussion on it. That's okay. The first one only took us 10 minutes, so you're like way ahead of schedule. You're fine.
Okay, so this one, all right. Sorry. Okay, so this one is, so currently, the dilemma is that when people are currently under their internship, so when they're in school and they're completing that, they're able to actually intern at an outpatient private practice, which makes sense. They have the supervisor and all that, that's fine. Now, the issue is right now with the way that this reads, once they are waiting on when they have just their conditional license, so they're waiting on their permanent licensing. Yeah.
Technically, there's no
Oh,
conditional
sorry.
license involved, though. They're
Oh,
just
okay. Well,
they're
when
an
they're-
unlicensed person at this particular
Unlicensed. So
point.
when they're
Yeah.
unlicensed, but they are still able to work currently at an institution. So what stops though is them not being able to continue. So they've been interning in an outpatient private practice that is allowed by law. But once they graduate and they're waiting on that licensing, even though they could still be under supervisor, right now they can only work at a state institution or facility. And so we're just adding outpatient private practice. We're not taking away the supervisor or anything. We're just allowing that continuum of care because they can have, upwards of 100 patients that all of a sudden, sorry, I talk with my hands too much, that are all of a sudden not able to receive that care. So it's just really helping with that continuum and more of housekeeping.
So
I have a question.
yeah,
Yes.
That's okay.
that's fine.
From the testimony on 1413, actually, I
Yeah.
got the
Oh.
impression
Sorry.
that someone who just graduates can go to work for a nonprofit clinic immediately
Mhm.
but cannot go to work for a private organization until that private organization has a supervisory agreement specific to that person in place. And why the discrepancy? That was why I hoped you would
So
get somebody here.
Here, I've been knee deep in this for a couple days now, and we just had a lot of fun over lunch break. Actually, talking to Lindsay. Here's the problem with this section of law: nothing's defined. So if you're looking for the definition of any of these terms in statute, you will not find them. So it's wide open to interpretation. Institution is not defined, facility is not defined, and to be fair, outpatient private practice is also not defined if we add that in, and clinical supervision is not defined. So I was talking to Director Courtney on the phone, and ironically, she just was having a conversation with somebody who was running into this situation where the chair of the board had told her that she couldn't practice because she was in an outpatient situation and had to wait for her licensure to come through. And Director Courtney went down the same rabbit hole that I did, which was trying to figure out where in law it says that you can't, and we can't find one. We don't think that this precludes outpatient private practicing from continuing care because they still have supervision. So what we're considering doing is defining the terms in this section to cover the people who need to be covered specifically, so that when you go back and ask the question, what is facility, it covers outpatient private practice in its definition so that it includes everyone and there isn't any discrepancy. My concern with just adding outpatient private practice into this section is the vagueness of everything else is still in place. And in fact, we're adding vagueness by adding outpatient private practice, because what is that technically? And then we're going to have this other group of people. So what the chair of the board did not do is point to anything other than this piece of law, RSA 330A34, to indicate that this individual could not continue to serve at the outpatient private practice clinic and be legal. So, yes.
One one concern that I have is that this allows a totally unlicensed person to work under the general supervision of the staff, but a conditionally licensed person apparently needs a specific supervisory agreement approved by the board.
Yes.
And that appears to me to be a disconnect.
Yes. I agree.
So what's a good way to fix that
Yeah.
discrepancy?
That's what the discussion is. And hey, it's a pullback on licensing, so it's right up your alley. Hop in. Yeah, no, and we were having that discussion as well. I don't know if you guys would
Do you
feel
wanna come up
comfortable
here?
sitting next to each
I
other.
won't bite.
But yes. So the goal is, as Mr. Osterhout put it at lunchtime, you've got A, B, C, and D, and they all basically are doing the same thing, but we're creating an exemption for A, B, and C, but not D. That's what we're trying to get away from, so that everybody who's working within the same scope of practice has the same freedoms, the same opportunities. None of them are unfairly restricted. So yes, and that was also part of the conversation. So my request to OPLC has been already, and I was going to run it by the subcommittee as well, but since you're here, you can chime in, to come up with definitions that work to close all of those loopholes so that we can put all of those people under one umbrella and they're all operating by the same guidelines.
I think
So-
that's fantastic. Thank you for your work on that.
Yeah. Because
That showed up when at the hearing for 1413, when it appeared that most of the testimony was irrelevant to the bill.
I mean, we were sympathetic, but didn't
Oh, okay.
didn't pertain. So yeah, so we're in this kind of strange, and this is why I said it was going to be an interesting conversation. We're kind of in this strange realm where you're saying you need this change because otherwise they can't do it, and both OPLC and at least me agree that I don't think this says that they can't.
Well, I think if I could
Yeah.
explain that, where that came from. So there are a few private practices that are very conscientious, and also with their insurance, looking at that, their malpractice is going, wait a second. So this is something that I think would be very helpful to be more defined, because especially when you have, anytime you're in the medical field, the malpractice and your insurance is so specific and you have to be so careful. So I think these are situations where people maybe are being overly conscientious, but for good reason. I think there have been issues that have come up. So
Yeah, well, and that's what we've been trying to get to the bottom of, and we have not been able to find anything in rule or statute outside of this. And so I think that the confusion came as to where this idea came from, and we can't figure out where the idea came from. So if you were to go ask the chair of the board, which is somebody that you would typically go to ask the question whether or not this is a problem, that person would say that this is a problem, but we can't figure out why they're saying that this is a problem, and that's where this is getting a little confusing. Mr. Osterhout, would you like to share anything? I don't
know
remember if
what
I forgot something that you
Yeah,
remember.
I don't know what you left for me to say. I think you stole all my testimony.
I'm so sorry. I feel terrible. I usually like to share, and I guess I wasn't playing nicely. But you agree with
I agree.
what I've said.
I think
See, there you go.
you
Just
go.
the weight of your testimony behind me is helpful.
getting things done.
just thought I'd sit here by myself.
But yeah, I think I don't understand where that interpretation's coming from, because I certainly didn't read that in the law, and the OPLC doesn't read that into the law. And if there's ambiguity, I think it's best addressed by defining words rather than keep carving out exceptions. And then, to your point, we carve out one more. Does that now preclude something else that we didn't foresee? Let's just define it. Get rid of that ambiguity as much as possible, and I think that's going to be better for everybody.
Yes, Chair McGuire.
I think one thing you could just say, instead of saying institution, facility, etc., say it's an organization that that provides these clinical mental health services, has licensed individuals on staff, and provides supervision, because that's, you don't really care how it's set up as a not-for-profit or for-profit or a hospital branch or whatever.
Right.
It's just that it's an organization, it has licensed people on staff that provide supervision to either conditional licensees or unlicensed individuals.
That makes sense to me.
Is that, I don't know quite how you'd say that, but that's the point, is that
Yeah.
those organizations do have licensed people on staff.
Right. Thoughts, Mr. Esterhaus?
I think that's a policy decision, right? And then if you want me to define words, we can work on definitions. And if you think this, I wrote down the key components, the organization, licensed people on staff, and supervision. We can play around with that language too and see if we can make it simpler.
Mhm.
Absolutely.
Any other thoughts from the committee?
Because I think the goal is, right, like you mentioned, is to
Level the playing field.
level the playing field, and we don't have different classes of people here, but we're treating them like we do.
Yeah.
And that's the problem. And wherever the confusion came from.
Yeah. No, so my only other concern is what you brought up, which is once you start adding in supervisory agreements, which is a little bit different, but then you don't have the institution behind it. You don't have the organization behind it, which that's going to affect a lot of the rest of 330A, because a lot of the rest of 330A deals with supervisory agreements. So this is an exemption from, in part, the supervisory agreements.
And the intention is that that is to be the individuals who would qualify for a conditional license. That is, they've been trained, but they are not through their residency, as it were.
So, and I've been informed by Director Courtney that in this specific instance, there isn't really a conditional license. It's just a 2-year permanent license.
Really? Wait a minute, we just
called,
got,
it's called a conditional license, but it's really it's kind of a unique license type in and of itself, where you need this supervision while you complete your hours. So the term conditional is really there because it's not permanent, but it is a 2-year license.
it's conditional on them, they can work, but if they don't complete their supervisory hours by the end of the license, they're in trouble.
And eventually you should graduate to permanent licensure, full licensure. Is the idea.
That's just what she said. I don't know.
You can call it whatever you like.
Whatever it is. By the end of this day, temporary license, conditional license, permanent. It's just
It's
mix it up and pull one out.
It's
I don't know.
not temporary.
yeah.
It's conditional or,
Oh no, this was a conversation from
different
the
one.
last bill. Yeah, that
Sorry,
doesn't.
I missed
No,
out on
that's
that
fine.
one.
That was totally for Doug, mostly.
yeah, I had Brad look up the history on this, and this was not really discussed. And since it was 30 years ago, 25 to 30 years ago, there's nobody around that remembers.
Right. Okay. Well, unless anybody has something else to add, I think that's I mean, that makes sense to me. That would probably be the easiest way to go, is just to create the
Just clarification. on
clarification.
what
Yeah.
Do you want us to do the organization licensed people on staff supervision route, or the defining?
Well, if we do
institution
that, I think
facility?
we just remove institution facility
Okay.
from it altogether. And then maybe we'll have to define what clinical supervision is, because I think that the idea behind clinical supervision is that the organization itself has supervision, has supervisors. It's not a supervisory agreement. It's not a one-on-one. You might have multiple people under one supervisor. So I
In
think
fact,
we
they usually do.
yeah, so I think that we'll want to define clinical supervision, and then I think you're good. I think that solves it. I hope.
Thank you all so much. I really appreciate your work on this, and I see how thorough it was. You're so good.
25 minutes. I told you.
Thank you all, though. I
Okay.
really do appreciate you.
It was better that you were here, though. I appreciate it.
Well, I was the one who listened to the tip and then decided that we needed to consolidate these two or
Yeah.
consider them together.
Right.
All right, so this one, you got a nice simple amendment on that?
Yep, it should be pretty easy.
All
I'll get
right,
that written
and
up.
I'll work with Doug to get an amendment for 1311,
11:31.
1131.
Perfect.
Okay. Thank you so much. Thank you for for having done so much of the work.
Yeah. No, that did help. All right, I'm gonna close the work session then, and thank you guys so much for your time. I really appreciate it, and we'll see you Wednesday. So we will have a subcommittee meeting Wednesday morning at 9 a.m. because we're gonna have to vote on the amendments that are coming for this stuff
The full
Yes.
committee is meeting, I think, at 10.
at 10. But we're gonna meet at
Everything.
9, and I will need people there because they'll be voting. So if you can, that'd be helpful. If not, let me know so I can replace you.
On the other hand, take Tuesday.
That's fair.